Triplex ultrasound peripheral arterial disease. Peripheral arterial disease is narrowing or insufficiency of the arteries other than those that supply the heart or the brain. Arterial insufficiency is any condition that slows or stops the flow of blood through your arteries. Peripheral arterial disease, either functional, like Reynolds phenomena, emotional stress, cold, temperatures, vibrating machinery, or your tools, drugs. Or organic peripheral artery disease like arterial insufficiency, which causing narrowing stenosis. Organic peripheral arterial disease, arterial insufficiency, narrowing stenosis. Organic arterial insufficiency, organic arterial narrowing, organic arterial stenosis, divided into acute arterial insufficiency, peripheral arterial occlusive disease, chronic arterial insufficiency, atherosclerosis, predisposing risk factor smoking, high blood pressure, diabetes, high cholesterol, chronic arterial insufficiency as in fasciculitis. Arterial Doppler waveform divided according to resistance, pulsatility into low resistance, low pulsatility waveform as in brain renal bed flow, intermediate resistance and the pulsatility waveform, high resistance, high pulsatility peripheral, high resistance, high pulsatility waveform as in peripheral arterial waveform, lower upper limb. High pulsatility resistance waveform, triphasic waveform as peripheral arterial disease, formed of 3 components with second reversed component in diastole, early diastole, low pulsatility, low resistance waveform as in brain renal bed, characterized by continuous flow through systole and diastole above baseline, no reversed flow component to maintain blood supply to this vital organ all time, no negative flow like high resistance, mixed pulsatility and resistance waveform midway between low and high pulsatility. These 3 changes of waveform present in our body, in our arteries, divided according to pulsatility and resistance. Arterial Doppler waveform according to phasic number. Triphasic flow formed forward flow in systole, reverse flow in late systole or early diastole, forward flow again in late diastole, triphasic formed of 3 phase, biphasic flow formed of forward flow in systole, reverse flow in diastole, third component not present, monophasic flow mean single phase with slow dampened flow, acceleration, deceleration, high velocity and low velocity divided. Monophasic flow, single phase with slow dampened flow. Monophasic flow may be high velocity or low velocity flow. Triphasic flow considered normal. Monophasic flow abnormal. Most authors consider biphasic flow abnormal Also, some authors classify it as normal waveform. Triphasic flow diagram: flow which start above baseline and cross below baseline, then cross above baseline again. This triphasic flow formed of three phases: systole, early diastole, reversed, and late diastole above baseline, forward flow. This is triphasic. Biphasic flow start above baseline, then cross to other side, formed of two component, systole and reversed diastole. No third component above baseline not present. Biphasic flow present in both sides of baseline, above and below. Late diastole not seen in what's called biphasic flow. Biphasic flow, two waveform, two phases, consisting of sharp systolic forward up raise and full an element of reverse flow during diastole, expected in arterial segment proximal to obstruction. Monophasic flow flow in one baseline side. Monophasic flow in systole only, either continuous to next systole or not continuous. This example: poor planted monophasic flow, loss of sharpness in systole, lack of a reverse diastole element, and a slow diastolic full expected in arterial segment distal to an obstruction. Discontinuous monophasic flow. This is continuous monophasic flow from systole to systole. This is not continuous monophasic flow, interrupted, no flow between both systole, diastolic block, no flow during diastole, present in venous obstruction. Sharp monophasic consists of a sharp systolic raise, lack of a reverse diastolic element, and a fast diastolic full. Bidirectional flow occurs simultaneously in both sides of baseline. Bidirection flow. Doppler velocity waveform, either we summarize triphasic in normal artery, biphasic with increased velocity through a mild stenosis, monophasic with greatly increased velocity through tight stenosis, monophasic high velocity or monophasic dampened velocity, dampened monophasic flow with reduced velocity. Quadriphasic flow not important in peripheral arterial disease, another type of waveform. Factors affect pulsed waveform reflected on evaluation: cardiac pump function, cardiac insufficiency, aortic valve function, aortic stenosis insufficiency, course of vessel tortuosity, vessel branching, peripheral vascular resistance, as in peripheral inflammation, polyneuropathy, warm or cold extremity, vasospastic disorders. Arterial waveform changes associated with arterial disease in the lower limb or upper limb. Understand, absorb, and save this arterial waveform changes. What is waveform changes associated with disease in the lower limb? Importance of that Sometimes we not visualize stenosis directly, but you can expect presence of abnormality in artery through this is arterial waveform changes. This arterial waveform changes means that something abnormal, but it's not always localized site of the lesion. We may see this arterial waveform change in site other than site of the lesion, other than site of arterial stenosis, proximal or distal to stenosis. When we found this arterial waveform change, we must search to explain it, how it comes. Arterial waveform changes must be explained and have causes. We understand it. First, loss of third, then second phase of the waveform, increased acceleration time, rapid arrays of systolic deflection, widening of the systolic complex, spectral broadening, damping of the waveform, spectral broadening, fill-in spectral window, loss of sharpness of the spectrum, irregularity, turbulence, aliasing, rounding of peak systolic velocity tip, absent flow in occlusion, rising of peak systolic velocity, reverse flow opposite systole, rapid fall of systolic deflection, rising of end diastolic velocity. Development of an abnormal waveform spectrum does indicate the presence of a lesion, but it not accurately indicates the location of the lesion. Abnormal waveform spectrum seen at site of arterial disease and also seen away from arterial lesion either proximally or distally. Loss of third is in second phase of waveform. Then we see loss of third late diastolic component by phasic waveform. Then second waveform monophasic, triphasic normal flow become biphasic, monophasic. This is abnormal waveform changes. Present either proximal to stenotic lesion or distal to stenotic lesions. Loss of normal triphasic waveform in the common femoral artery as indirect sign of iliac arterial stenosis. In iliac arterial stenosis, when we examine lower limb, we found waveform change in common femoral, which is loss of normal triphasic pattern, monophasic like this. This is give attention to us. We have problem proximal to common femoral, that is iliac artery stenosis. This is indirect sign of original lesion. Abnormal lower limb artery waveform, loss of reverse component, damping is a waveform, present proximal or distal to stenotic lesions, fill in spectral window, this area which is present under systolic lines, fill in spectral broadening, turbulence, reverse flow, opposite systole. This is abnormal waveform change in lower peripheral limb arterial disease. Loss of sharpness of the spectrum is abnormal waveform change, irregularity, reverse flow opposite to systole component. This systolic component, we found a reverse flow, this area. This is abnormal waveform change. Rising of end diastolic velocity, abnormal waveform change, impress peripheral arterial disease, rounding of the peak systolic velocity tip, normally sharp, rounding this abnormal waveform change, absent flow in occlusion totally, identified by spectrum and color, rising of peak systolic velocity, abnormal waveform change. What is values suggest degree of stenosis? Direct measurement of stenosis, peak systolic velocity changes, and the diastolic velocity ratio. This is value which suggests degree of stenosis. Measured peak systolic velocity at stenotic segment divided by normal segment, 1.5 to 2 by 1 means 30 to 49 degree of stenosis. 2 to 4 by 1 mean 50 to 75 degree of stenosis. More than 4 by 1 mean more than 75 degree of stenosis. What's the velocity criteria for the assessment of lower limb stenosis? Normally less than 1.5 centimeter per second, velocity ratio less than 1.5 to 1. Degree of stenosis up to 50%, impress peak systolic velocity 1.5 to 2 with velocity ratio 50 to 75 degree of stenosis, impress peak systolic velocity 2 to 4 centimeter per second. More than 75 degree of stenosis, impress more than 4 centimeter per second. Occlusion, no peak systolic velocity because no flow, no spectrum, no velocity ratio. Causes of disappearance of reverse flow, second component, which leading to monophasic flow. Causes of disappearance of this second flow. Second component, reverse flow of triphasic waveform. Disappearance of reverse flow in triphasic pattern of waveform due to maintenance relatively high level of forward flow because of the pressure gradient across the stenosis throughout the cardiac cycle. Resistance to reversed flow created by the stenotic segment as proximal to obstruction. A decrease in the peripheral resistance due to relative ischemia causing hyperemia. Damping of the pressure waveform by the lesion, resulting in attenuated pressure waves less liable to reflections and amplification that normally contribute to diastolic flow reversal. This mechanisms of disappearance of reversed flow in triphasic waveform. Monophasic flow which a result of disappearance of reverse flow, second component, present in hyperemic state, normal peak systolic velocity, normal AT, time between beginning of systole and peak systole, acceleration time. Monophasic flow present in exercise, in fever, downstream infection, temporary arterial occlusion by blood pressure cuff, as in tardus parvus waveform, low peak systolic velocity, longer ascending time, distal to severe stenosis or occlusion. This is monophasic flow physiologically, as we found in clenched hand triphasic pattern, pressure Released hand after clenching, we found monophasic flow. Preoperative color Doppler ultrasound of the radial artery showing change from triphasic, high resistance to biphasic, low resistance Doppler waveform as a result of hyperemic reaction. This is example of loss of reverse component of triphasic waveform. Monophasic flow, hyperemic flow following exercise. Monophasic flow, hyperemic flow following foot infection. Monophasic signals impress abnormality in peripheral arterial disease. Monophasic damped sump proximal to stenosis. Monophasic sump proximal to stenosis. Loss of reverse component of triphasic waveform, one of abnormal waveform changes. Monophasic result in monophasic flow, which is direct or indirect signs of peripheral arterial disease. Monophasic signal impress abnormality in peripheral arteries. Monophasic continuous distal stenosis. Monophasic signal impress abnormality in peripheral arteries. Discontinuous monophasic flow as in diastolic block, no flow during diastole, no reverse flow as in venous obstruction. Post-operative vasospasm limb ischemia. Discontinuous monophasic flow. Left dorsalis pedis artery showing abnormal monophasic flow. What is definition of active hyperemia, which causing reverse diastolic flow disappearance? Active hyperemia result in monophasic flow. Active hyperemia leading to increase in organ blood flow, leading to increased metabolic activity, and leading to vasodilation, vascular recruitment, result in vascular resistance decrease, result in disappearance of reverse component of triphasic waveform, result in monophasic flow. What is causes of the active hyperemia? Active hyperemia as a result of muscular contraction, termed exercise of functional hyperemia. Active hyperemia increased cardiac activity, increased mental activity, increased GIT activity during food absorption. Doppler spectrum normal dorsalis pedis in the foot showing monophasic hyperemic flow during exercise. Iliac artery at rest, triphasic, iliac artery following exercise, result in monophasic flow following hyperemia, functional hyperemia. Physiologic change in vascular resistance of the lower extremity induced by vigorous exercise. Normal high resistance triphasic arterial waveform, and this is waveform obtained immediately after vigorous exercise, shows low resistance flow pattern. What causes of increased antegrade flow? Increased in diastolic flow, increase in flow above baseline of the arterial waveform changes. Increase antegrade flow to increase maintenance of blood flow during cardiac cycle. When we increase need of more blood, there is adaptation, increasing flow above baseline, increase in diastolic flow. Following exercise, increase more need of blood flow, like following exercise, flexion, extension, or transient ischemia. Amplitude of forward diastolic flow normally physiologically increases. Uterine artery, and at 30 weeks we increase blood, we need more blood flow to fetus, so vascular resistance decrease and increase antegrade flow, physiological response. What is effect of exercise? Exercise and the temperature effect in the arm or lower limb in the periphery. Temperature and the arm causing decreased resistance and increased blood flow, causing monophasic and continuous flow throughout diastole. Cooling, what result of cooling? Cooling result in waveform amplitude decrease with persistent triphasic pattern. This effect of temperature and exercise and this effect of cooling. At rest, normal high resistance triphasic flow in iliac. Following exercise, low resistance flow pattern with appearance of reverse component, continuous monophasic flow, functional hyperemic. Limb at rest, 3 component triphasic pattern. Following exercise, there is increased diastolic flow, normal femoral artery waveform physiological response. At rest, right common iliac. After exercise, isolated high-grade stenosis apparent, become evident. Following exercise, loss of sharpness of systolic flow. What's effect of temperature and the arm exercise and cooling in waveform? Cold room or cold ultrasound gel applied to hand can cause a significant peripheral vasoconstriction, leading to high resistance flow signal in radial and ulnar arteries. What's effect of temperature in waveform? Doppler waveform radial artery showing variation with ambient temperature. At room temperature, peak systolic velocity 45. Taken after immersion in a hot, systolic velocity increased to 70. Taken after immersion in ice, peak systolic velocity decrease. Cyclic appearance of waveform pattern in radial and ulnar arteries at rest and the hand from high resistance to hyperemic flow in space of minutes related to factor like body temperature. What causes of increased reverse flow? We talked before about disappearance of this reverse flow, early diastolic flow. What cause of increased reverse flow? Venous obstruction causes increased reverse flow. Anything increased peripheral resistance like blind end channel, like digital artery atherosclerosis, cause increased resistance radial and the ulnar posterior tibial artery, also in venous thrombosis. Typical velocity waveform profile, peripheral artery at rest, peripheral artery increased peripheral vascular resistance, peripheral artery reactive hyperemia, disappearance of reverse flow in reactive hyperemia, increased reverse flow and increased peripheral resistance. What cause of loss of third component biphasic flow? What cause of loss of late diastole, forward diastole in triphasic waveform? Loss of arterial elasticity and compliance. Any disease in the wall. Arterial elasticity and compliance responsible of third late forward diastolic flow. So any arterial disease affecting the wall causing loss of third component. Loss of third component characteristic waveform in stenosis 60% because of arterial wall disease. Loss of compliance and elasticity of the wall. Loss of third component severe short stenosis, irregular calcified plaque, result in loss of reverse component of the triphasic waveform. One of the abnormal waveform changes. Biphasic waveform, loss of third component with peak-shaped early diastolic reversed flow as in acute tubular necrosis. Biphasic flow, areas under systolic and diastolic waveform equal, indicating absent net flow in graft as in venous thrombosis. Loss of third component of triphasic waveform. Long time reversed flow. Biphasic flow with increased reversed flow and loss of third component. Reversed flow increase in velocity. Reversed flow increase in duration in this spectrum. Waveform reversed component increase in velocity. Sudden decrease of reversed flow velocity in early diastole. Areas under systolic diastolic waveform equal in venous obstruction. Mid diastolic notch in reverse flow, called it inverted M sign. Biphasic flow, biphasic waveform show slow retrograde flow throughout entire diastole as in acute tubular necrosis. Spectral broadening. Laminar flow in vessel of radius flow course as a result of pressure difference between 2 points a distance apart. The velocity of this movement of flow in the center of the vessel is maximum. Follow parabolic profile to the edge of the vessel. This example of laminar flow. Laminar flow occurs when blood flow in parallel layers. No disruption between these layers. Flow in typical blood vessels follows a blunt profile. The velocity of the flow is relatively uniform over the center of the vessels and falls off at the vessel wall. Laminar flow occurs in parallel layers. In stenosis, what happens in turbulent disturbed flow? Flow will result as a separation of the aerials flow, separation of parallel irregular flow in random non-parallel direction. Non-parallel occurs downstream from the stenosis. This turbulent flow. What's spectral line? Spectral bandwidth, spectral windows. Spectral line is the line forming uniform and continuous spectrum, normally sharp and regular. Spectrum window is a clear space beneath systolic peak. Spectral window. Spectral window narrow frequencies ring in result in clear window. Bandwidth is width of systolic peak. Bandwidth. Spectrum bandwidth is width of systolic peak. Spectrum line. Spectrum window. Spectral window. Normally spectral window is clear space beneath systolic peak. Spectrum line normally sharply defined. This envelope of a spectral window. Background, no spectral content. Spectral window, black zone clear between spectral line and the zero velocity baseline. Background, normally no spectral content. Why increase spectral bandwidths? Why spectral broadening? Why spectral fill in? Spectral for spectrum waveform contain wide range of frequencies and parameter caused by random non-parallel distribution of velocity of red blood cells in the vessel. This occurs in turbulent, disturbed flow, irregular, non-parallel, random distribution of velocity of red blood cell in vessels, result in wide range of frequencies and parameters, result in spectrum waveform of turbulence and disturbance. This as a result of stenosis causing parallel flow to becomes irregular, random, non-parallel, distributed randomly in the vessels. This results in a range of frequency and parameters, multiple frequency and parameters, result in this form of turbulent flow, disturbed flow. Spectral broadening. Normally flow is laminar with a narrow frequency band at systolic peak. Flow is laminar with narrow frequency band, this area of frequency band, systolic peak. Spectral broadening, broadening of spectral lines broadening, broadening of one band width and spectral window due to the Doppler effect caused by random non-parallel direction, non-parallel distribution of velocities of red blood cell in vessel, result in spectral broadening. Broadening of bandwidths, broadening of spectral line, broadening of spectral window. It's narrow spectrum, normally narrow bandwidths, narrow distance between spectral line, narrow spectral window. This spectral broadening, broadening of bandwidths, broadening of spectral lines, broadening of spectral window, broad spectrum. Normally spectral line sharp and abnormally it is irregular in turbulent flow, disturbed flow. Fill in spectral window, what mean? Normally spectral window clear, no spectral content. Abnormally fill of spectral window, call it fill in spectral window. Abnormally fill in spectral window fills with flow signal as a result of random distributions of velocities of red blood cells as a result of stenosis. Minor laminar flow disturbance indicated by spectral broadening. This laminar flow, this disturbed flow. Minor laminar flow disturbance is indicated by spectral broadening. We have laminar flow, normally disturbed flow, turbulent flow. Disturbed flow is intermediate between laminar flow and turbulent flow. In laminar flow, spectral width normal, spectral window clear, no fill in. In disturbed flow, spectral width broaden, fill in spectral window. In turbulent flow, broadening of spectral width, loss spectral window, reverse its systolic component, erratic flow. This example of normal laminar flow, disturbed flow present by spectral broadening, fill in spectral window, turbulent flow present by spectral broadening, loss of spectral window, reverse its systolic component, erratic flow. Relation between bandwidth and vessel size in constant sample size. Increase vessel size, increase bandwidth. Bandwidth, it is area under systolic peak. Area of systolic peak which filled with flow signal. In small vessels, small area systolic peak. Larger vessels increase bandwidth area from this line to this line. More larger vessels, more bandwidth area. This is flow profile, relation between bandwidth and vessel size. Laminar flow bandwidth in this small vessel size increased. This is laminar flow when we increase vessel size, and constant sample volume, bandwidth decrease. More increased vessel size with constant sample volume, plant flow. This relation between bandwidth and the vessel size this relations between flow profile, vessel size, and bandwidth. This example of turbulent flow, spectral broadening grading. Category A, normal vasculatures, Doppler criteria triphasic biphasic waveform, systolic window present, no spectral broadening. Minimal disease, minimal stenosis, 1 to 90% spectral broadening present. Moderate disease, moderate stenosis, marked spectral broadening. Severe disease, hemodynamically significant, more than 50% area of stenosis, extensive spectral broadening. How is spectral broadening in color mode? Spectral widening or broadening by color mode. Spectral widening or broadening with widened velocity ring can be imaged by adding a third color, oven yellow, to the color display. This color represents areas of widened velocity ring typical of turbulent flow. Color coding of spectral broadening. Yellow saturation can be added to red and blue in the presence of spectral broadening with widened velocity ring. This is non-stenosing carotid artery plaque. Is spectral broadening always detected in color mode? Color duplex depends on flow direction and a single main, so color duplex may not show some high velocity gates that are apparent on a spectral waveform. While when easy yellow saturation present, Yellow saturation present usually absent at the center of large vessels, where frequency shifts are more uniform, minimally present. Yellow saturation seen at bifurcation of the vessels. Yellow saturation seen at vascular loops. Yellow saturation seen along vessel walls, typically present in atheromatous vessels where normal flow is altered. Disturbed flow. Character of disturbed flow is spectral broadening and fill-in spectral window. Flow disturbance, fill-in spectral broadening. This is fill-in of spectral window, spectral broadening, character of flow disturbance. Stenotic lesions result in marked disturbance in flow with occurrence of abnormally high velocities jet effect. Spectral broadening mean disturbance and turbulence. Fill-in window mean different speed. As we see in this image, in disturbed flow, what happened? Irregular travel of particles at various directions and at different velocity in the eddy formation as a result of stenosis. Turbulent flow and disturbed flow, a change in the direction of particles, movement of RBCs with respect to the axis of the vessel, alters recorded Doppler signal and contributes to the occurrence of a large ring of flow velocities registered with frequency spectral analysis as widening of the band of systolic velocity, spectral broadening, or complete filling in of spectral tracing. Flow, how is main disturbed flow occurs? Disturbed flow illustration, minor flow disturbance indicated by spectral broadening. Laminar flow, disturbed flow, turbulent flow. This parallel, irregular direction of flow of blood RBCs, this mild, moderate irregularity of layers of flow. This is severe, random, non-parallel distribution of flow velocities caused by random movement of the RBCs in the vessels as a result of stenosis, this turbulent flow. The intermediate state between laminar and turbulent flow called disturbed flow. Disturbed flow is a transient response by laminar flow to a source of instability, such as an atheromatous plaque, which create minor random interactions between the velocity layers. Disturbed flow deteriorates downstream from the source and regain laminar stability. Non-laminar disturbed flow patterns are encountered at sites of bifurcations or in these vessels. This normal pre-stenotic vessel segment, stenotic segment, who found disturbed turbulent flow at the point of stenosis and immediately downstream. High-grade stenosis and an extremity artery systolic flow acceleration seen. Turbulent flow, how come? Turbulent flow when the rate of blood flow becomes too great, when it passes an obstruction stenosis in a vessels, when it makes a sharp turn, when it passes over rough surface, decreased viscosity of blood, trauma, injury. This is states where turbulent flow occurs. The flow may then become turbulent rather than streamline. This is turbulent flow irregular travel of particles in various directions at different velocities. Turbulent flow means that blood flow crosswise in the vessel as well as along vessel wall, forming whorls in the blood called eddy currents. These are similar to whirlpools that's one frequently. Change of direction of particles movement with respect to the axis of the vessel alters recorded Doppler signal and contributes to the occurrence of a large ring of velocities, the flow velocities registered with frequency as spectral analysis, as widening of the band of systolic velocity, spectral broadening, complete fill-in of spectral tracing. Flow through stenosis followed by rapid expansion of downstream, showing regions of flow reversal. Velocity increase as blood flows through stenosis followed by an area of flow reversal beyond the narrowing. This is result in turbulent flow. Diagram: stenosed vessels peak systolic velocity ended systolic velocity measure embrace stenosis degree. Post stenotic broadening embrace turbulent flow, which gives stenosis flow. How is disturbance flow presented? Presented as reverse diastolic flow, loss of sharpness of spectrum of spectral line, spectral broadening, fill-in of spectral window, erratic flow. This is turbulent flow, shows spectral broadening, loss of spectral window, reversed systolic component of flow, erratic flow. Erratic spectrum, erratic flow, loss of sharpness of spectrum, loss of sharpness of spectral line, spectral broadening, fill-in spectral window, reversed systolic component, reverse flow, opposite systolic component. Aliasing is another character of turbulent flow. This is turbulent laminar disturbed flow character. Normal laminar flow, triphasic, regular, clear spectral window, narrow band width. Biphasic Doppler was loss of reverse diastolic flow, mild widening of spectral window, spectral broadening. Spectral broadening, intermediate between normal and turbulent flow. Turbulent flow found fill-in spectral window, spectral broadening, low peak systolic velocities may be seen. Irregular spectral line, loss of sharpness. Highly turbulent flow show in color turbulent flow, lots of green signal, ovariance color, small calcified plaque seen, spectral broadening, fill in spectral window, reversed flow opposite to systolic component. Turbulent flow, spectral broadening, loss of sharpness of spectral line, spectral fill-in, reversed flow opposite to systolic component. Short stenosis, severe, caused by irregular calcified plaque, result in turbulent flow, increased velocities in the stenotic areas. Fill in spectral window, reverse flow opposite systolic component, spectral broadening. Spectral analysis isolated high-grade stenosis who found turbulent flow, and this is after exercise, more manifestation of turbulent flow. What is turbulence grading? turbulence grading. Causes of stenosis: peak systolic velocity, turbulence grading. Normally, no elevation of peak systolic velocity, no turbulence. Of 15% stenosis from normal to 15, found minimal turbulence. 50 to 75% stenosis, we found significant turbulence. 75 to 99% stenosis, we found severe turbulence. Occluded vessels, no flow, no turbulence. Where is maximum disturbance occurs? Maximum flow disturbance occur and flow turbulence 1 cm from disturbance, 2 cm less disturbance, 3 cm laminar flow re-established. Down to stenosis, never found triphasic flow. Down to stenosis, we never found triphasic flow. It's very important. What is Reynolds number? A Reynolds number: turbulence equal diameter by velocity over viscosity of the flow. Diameter of the vessels multiplied by velocity over viscosity of flow. Reynolds numbers, which measures the tendency for turbulence, direct proportion to diameter of the blood vessel in centimeter, direct proportion to the velocity of blood in centimeter per second, inverse proportion to the viscosity of blood. The development of turbulence depends mainly on velocity of blood flow and the size of the vessels. Aliasing. What's meant by aliasing? When aliasing occurs, we know that probe ultrasound transmits ultrasound wave which reflected when meeting RBCs and received by probe receptors in the probe. This process pulse repetition frequency, which is number of pulses within 1 second, transmitted reflected waves. We transmit wave impulses. Number of pulses called pulse repetition frequency. Pulsed wave Doppler. Pulsed wave Doppler employs element of the transducer that send as well as receive signals. Ultrasound emitted impulses. Between these pulses, the same transducer element receives the reflected signal, as every emitted pulse is paired with a corresponding return signal. The pulse repetition frequency can be altered by the operator to prevent aliasing or to detect low blood flow. As a general rule, the pulse repetition frequency should be ideally set at approximately half of the expected velocity of the blood flow in the region of interest. For example, the artery blood flow is approximately 70 to 80 cm per second in the normal adult. The pulse repetition frequency therefore set at velocity range between 30 to 40 cm per second. Blood flow in this artery is much slower, approximately 40 to 50 cm per second. Pulse repetition frequency also set at lower velocity range, approximately 20 cm per second. What happened if blood pulse repetition frequency left 30 to 40 cm per second? Then color filling of the vessel will be reduced. If we leave BRF at 30 to 40 cm per second and blood flow in the artery 40 to 50 cm per second, what happened? Reduced, allowing For poor visualization, color feeling of the vessel will reduced for poor visualization of the vessel, and spectral trace illustrated as a very small trace in a large field of view. Increased waveform blood velocity fast, increased scale velocity, half of the BRF pulse repetition frequency. Velocity above this limit will display on the trace opposite to the true direction of blood flow. When increased velocity of the blood vessels occurs, scale velocity increased. When increased waveform blood velocity and in stenosis more than scale velocity, more than half of the pulse repetition frequency, what happened? Aliasing. Velocities above this limit will be displayed in the trace opposite to the true direction of blood flow. Aliasing. Either color aliasing present as bright, turbulent appearing flow in color mooding with different colors, yellow, green, variant. Spectrum aliasing wrap around, displayed scale impulse wave spectral Doppler tracing opposite true scale direction. How to manage aliasing? Increase pulse repetition frequency, increase scale peak systolic velocity. Probe can read high blood velocity waveform. Decrease pulse repetition frequency, decrease scale peak systolic velocity. Probe can read low velocity blood waveform. This example of aliasing. Spectrum aliasing. Waveform with aliasing. Abrupt termination of the peak systolic velocity displays peak flow baseline sonogram clear. This, as we see, this is spectrum. Abrupt terminations of peak systolic velocity with wrap around of a remnant, a reminder of velocities, traced in opposite direction to the true of blood flow. In opposite direction, reminder of velocities, trace in opposite direction to the true blood flow. What happened? Increase blood velocity in this artery as a result of stenosis, and scale velocity less than half of this blood velocities. So high blood velocity, we found part of flow tracing in opposite direction to the true blood flow. Aliasing. Preset to low. Pulse repetition frequency low. If we adjust pulse repetition frequency, increase pulse repetition frequency, we increase scale velocity and decrease baseline, adjust the baseline, aliasing will disappear. So increase pulse repetition frequency, increase peak systolic velocity, overcome aliasing. This is pulsed wave with a depth of interest showing aliasing as a result of mitral regurgitation. Remember various methods to overcome problem of aliasing. Image at a shallow depth, increase angle of isonification, use low frequency transducer useful in examination of deep vessels, use continuous wave imaging, change scale, increase pulse repetition frequency, change the display baseline, change to a different position that's closer. These ways of overcoming manage aliasing. More aliasing and less aliasing. And more aliasing meaning faster blood velocity, higher frequency transducer, deep gate, low pulse repetition frequency. Less aliasing, slower blood velocity, lower frequency transducer, shallow gate, high pulse repetition frequency. Color aliasing, sharp color transition from yellow to green toward which caused by aliasing, blood velocity fast exceeding scale maximum limit. Adjusted aliasing artifact in Doppler stenotic arterial segment. This is aliasing, lowering baseline, one of adjustment, increase scale, increase pulse repetition frequency, aliasing disappear. Color aliasing in the same image with velocity scale, altered to eliminate aliasing. Color spectrum aliasing, iliac artery bifurcation stenosis.